Two. Hello, everyone. My name is Atishay Jain, and a junior in high school, and your host for today's episode of the Mental Health Corner. I'm passionate about spreading awareness to improve the well being of adolescents and adults alike through relatable stories and resources, which we will discuss together on this podcast. I bring in a variety of different people across different professions, including teachers, law enforcement, and even doctors. So please join me in welcoming today's guest, Lieutenant Thomas Egan from the Robbinsville Police Department in New Jersey. Thank you so much for being here, Lieutenant. Would you please tell the
Good morning.
audience a little bit about yourself?
Sure. Good morning, everyone. I am Lieutenant Thomas Egan from the Robbinsville Police Department. I've been a police officer here for going on 17 years now. My current role, I am the lieutenant for the patrol division. I am also one of our department's resilient officers in charge of making sure that our officers' mental health and resiliency is good. I have my bachelor's degree in criminal justice, which I got from Stockton University, and numerous on the job training throughout my career.
Thank you so much for that introduction. You mentioned a little bit about the resiliency program, and I know, of course, in the field, officers have to go through a lot of training when it comes to physical training, firearm training, vehicle training, and sometimes the mental health goes overlooked. So in that position of yours, how do you train officers to take care of their mental well-being on the field and even off the field as well?
Oh, we try to teach people to be the ball and not the egg. We need to bounce back when we are faced with some bad on the job scenes, calls, and really just checking in on your brother and sister officer to make sure that they're okay. Anytime we have a critical incident, we usually do a debriefing and sit around and talk about it to make sure that everybody's okay. And then if there are any issues, then we will get the appropriate help that's needed.
Gotcha. Thank you so much for that. And have there been any incidents where you seek external help as well from the sort of like mental health nonprofit organization, bring in like some people to talk to the department or any of that sorts?
Yes. Yeah, we have a number of resources. Primarily, we use an organization called Cop to Cop, which specializes in this. We also have chaplains that we can reach out to that will come in and speak with our officers, and other peer officers as well.
Gotcha. So that must be really rewarding to have those people like come in and speak to you. And as far as mental health awareness for adolescent community goes, I know the Robbinsville Police Department is really involved in the school community, our elementary, middle, and high schools. So could you expand a little bit about how the officers make a difference in the school community when it comes to drug prevention and mental health and all that?
Well, we're trained to be proactive and look for signs of potential drug abuse or mental health issues. So when we're out on calls, we might be out on call for something, a barking dog, and it might turn into a snowball into something else because our training allows us to see that. And once we are triggered to that, then we will, try to get that person help in whichever way, shape, form they need. If we have any like serious calls of service involving children that are in school still, we complete what's called a handle with care form that gets sent to their school. And it basically just gives the school a heads up that there was an incident where, it was potentially traumatic. Police were involved. Just a heads up in case, Johnny comes to school tomorrow and he's a little off, you understand why,
Gotcha. So it really involves a whole host of people when taking care of someone, and
Yeah.
it's more a team. And I really like how you mentioned earlier when you tell the officers it's more about be a ball rather than an egg, so you can bounce back. And I think that's really important given so many external factors nowadays, including the pandemic. That put a bunch of financial burden, financial stress, and even academic stress for today's adolescents when it came to the pandemic.
Yep,
So,
absolutely.
so how do you think that adolescents my age, me being a high schooler, how do you think that we can make the right decision for us when it comes to when we're put in a bad situation? What advice do you have when it comes to that situation and how to like make the right decision for us?
Well, I mean, I think that goes down to the character and integrity of the person. Um, but we all have to make good decisions, and what I tell everybody, especially in our careers, that we live in a fishbowl. Everybody's watching us, so you have to do the right thing even when nobody's watching. Um, you know, make sure that you let your conscience be your guide and do things that are morally and ethically correct. Um, and when it comes to mental health, we also stress that it's okay not to be okay, and that if you need help, you need to seek it.
And for someone who may be shy or for seeking that sort of help, how can you look for signs in say your friend who may be going through that sort of like mental, not mental unwell-being? How can you look for signs in that and seek help out for them?
I think that if you have a close relationship with somebody, you're going to notice changes. Maybe they're not as happy, maybe they're not doing the things that they normally like to do. Um, if someone is an outdoorsman, likes to go outside all the time, and now you're noticing that they're not leaving the house, that could be a red flag to start asking questions why. Um, People start trying to give you their, you know, property. We call it like unloading what they have. That could be another red flag. Just changes in demeanor, changes in appetite. If they're using any illegal substances, drinking alcohol excessively, missing work, missing school. Those are all red flags. Quitting a team that they're a part of, quitting an organization that they're part of, whether it's a camp or a program in school. Um, Maybe that's the time to start asking the questions. Are you okay? Is there anything I can do for you? Do you need help? Um, Stuff like that.
Gotcha. And in many of those situations, I feel that if you go out and ask someone, many times they would be kind of reserved and not willing to talk about it with you. And in that case, do you recommend seeking out help from a trusted adult or
Yes, yeah. I think if you have that gut feeling that something is not right, then you need to really do what you need to do to make sure this person gets an evaluation by a professional to see their status. Um, because the last thing we want to do is second guess ourselves.
gotcha? Gotcha. Well, thank you so much for sharing all those insights about the adolescent world and, especially as I mentioned, given the pandemic and so many different factors nowadays stressing our adolescents. Um, do you have any comment about the effect of social media on mental health?
Sure, sure. Social media, I think, is the downfall of our country and the world. You know, when I was a kid, we would go to school and you would leave school, and really the only interaction that you would have with people from school after that would be your friends, and it was usually a good interaction. Now you leave school, and if you're potentially a victim of bullying, not only are you getting bullied at school, but now you're going to get bullied on social media, and it just doesn't end. It's like a 24/7, vicious cycle. Um, I really don't think that social media is a place for children to be on. I think cell phones are great, but they can potentially lead to a lot of mental health issues because you're always, putting yourself out there to, for a negative outcome, especially if you're a victim of bullying or something else is going on. Um,
Right, for sure. And to all the viewers out there, take what Lieutenant Egan said into consideration. If you feel like you need help, if you feel like you're getting bullied, definitely reach out to trusted adults and trusted friends even you have many resources at your school, such as guidance counselors, your homeroom teachers, your advisors, and even your parents at times. It may be kind of intimidating at first and when it comes to talking about your mental health with someone, but there are people specifically trained for that, such as therapists and psychiatrists who are willing to help you where when it comes to it. So, Lieutenant Egan, thank you so much for your time once again. And if there's anything else you'd like to add, please feel free to go ahead.
No, I just want to thank you for taking your time out to start this initiative. And if I can leave everybody with one thing, it's okay not to be okay, you know. And if you're feeling that you need to talk to somebody, talk to somebody. Like you said, a trusted friend, a family member. You can call the police department and just say, "I'd like to speak to an officer." We'll come out and we'll talk to you, and we'll guide you in the right direction. We have a great relationship with the residents of our town, and we want to continue that. So anytime anybody needs some help, just give us a call. We'll come out and we'll talk to you. We'll get you where you need to be.
Remember, you're not alone. And what I like to think is a journey of 1,000 miles begins with one step, that being mental well-being and alleviating your mental stresses. Thank you so much to all of you for joining today's episode of the Mental Health Corner, and see you next time.